And how do you do that then? Is there, I'm not sure.
Okay.
We're getting
Looks like
people in now. We
we
see,
have
we
people
see,
entering the room now.
yes,
Wonderful. There we
Awesome. And
go.
it's recording, right, Anna?
Yes, we are recording.
Okay.
22.
Well, thank you everyone for joining us. Welcome, welcome. Some people are still trickling in. This is very exciting. We are here today for the surgical stories then and now. And this is one of the events leading up to Esperanza's 50th anniversary. We are super pumped and excited to celebrate that in a couple weeks. And this is one of our last events leading up to that. So thank you everyone for joining us today. We are very, very excited. I'm just going to jump right in and introduce our special guests for today. So the whole idea, about this event, Surgical Stories Then and Now, was to kind of do a comparison and contrast of what surgical missions were in the heyday of surgical missions at Esperanza and now. I've been at Esperanza for about 3 years now and have been helping run the surgical mission since then. But I've always wondered, what were they like before, when we used to work in Brazil? We did a trip to China. We used to do them in Bolivia. I've always had a curiosity for what those were like. So when this opportunity came up, we decided to do it with a group of donors and friends watching. Why not? So I'd like to introduce our special guests for today, Dr. Paul Schnur and his wife, Barbara Schnur. They are some of our volunteers from back in the 80s. They volunteered with Esperanza. They traveled to Brazil and China. That was our one and only time in China. They were there, so hopefully they'll be able to share some memories from then. Dr. Schnur is a plastic surgeon, and Barbara is a pediatric nurse. And also with us today, we have Dr. Feuerstein. Dr. Feuerstein is a current surgical volunteer and also sits on the board of Esperanza. He has traveled with us to Peru, Nicaragua, and also to Ecuador to do a site visit when we were trying to figure out whether to partner with our now partner in Ecuador. So, he's helped us in many different ways to grow the surgical program recently. So thank you both, all of you, for joining us today. This is very exciting, as I mentioned. I'm going to just jump right into my questions, if you don't mind. So first of all, um, when you were preparing to go on a mission to go get on a plane and get to a different country, did you have to recruit team members? If so, how did you recruit team members? And we're going to start with Dr. Schnur and Barbara.
Okay. Well, yes, we did. We had to recruit all of our own members. I think Esperanza was a little bit more primitive in those days, although it had been around for a long time because Father Tupper had been going down and taking people down, and Bill Dolan was the medical director. He was a general surgeon, so he would sort of put the trip together, but we would take along who we needed. The trip we took to Brazil, there was only one surgeon, that was me, and Barbara went as the nurse. And then we needed an anesthesiologist. So we recruited a fellow anesthesiologist that we worked with in the hospital, and his wife was a nurse, and we knew her. So basically, the four of us went down and did the surgery. So
Nice and compact team, right? That's great.
it was a relatively small team compared to some of the other teams we were on. China was a little bit different. Bill Dolan went along as a general surgeon, and we took two plastic surgeons along, and we took a number of nurses. I had several nurses. I was living in Tucson then, and we had 3 operating rooms in our surgical facility. So we had a number of nurses working with us that were surgically trained, and we took several of them with us to go down in China because we had a much larger. We worked in 3 hospitals when we were in China.
Thank you. Dr. Feuerstein, same question. Do you have to recruit your own teams, and if so, how do you do that?
Yes, and that was one of the factors that brought me to Esperança, because unlike a lot of programs where you get put on a team if you volunteer, I was very attracted to the idea of working with people that I knew, people who have worked together, who were already part of a coordinated team, rather than being put with random individuals. So yes, I found it very easy to recruit people. Lots of people want to do this type of work if you ask them. The more challenging part was getting those people to follow through and actually find the time in their schedule, be able to take time out of their professional lives. From a practical matter, the team started a lot larger than it finished. And in terms of the size of the team, what I found is the ideal size of the team really depends on the location and the setting. So in Nicaragua, tiny little critical access hospital, very limited operating room availability and staff. The best team is a small team that works all day in 2 rooms. On the other hand, in Peru, a larger, maybe regional hospital with a lot more personnel, much more conducive to seeing larger numbers of patients and doing higher volumes.
Great. In terms of preparing for the mission, did you have to pack any special tools, instruments, or personal belongings to prepare for Brazil, China, Peru, Nicaragua? Dr. Feuerstein.
It was a little bit of trial and error. We knew which cases we wanted to do. What I didn't know in the beginning was what they would have and what would be practical to use. So I'll say, like a lot of people, I overpacked the first time, which is funny, except that you have to carry everything yourself. So I think we had 13 huge suitcases to do our first little mission. And what I learned is that a lot of the things that we think are necessary probably aren't. And then there are some critical things. For instance, when we tried to do minimally invasive surgery, like laparoscopy, very specific things that were more important. So yes, we have access to vendors who have been very helpful, to surplus supplies. It's just a matter of fine tuning that critical list of things that you need, knowing the cases you're going to do.
Dr. Schnur, did you have to pack any special instruments?
Well, yeah, very definitely. Well, when we went to Brazil, if you'll recall, Esperança owned the facility in Brazil. So the facility was well known because they sent 2 plastic surgery teams down a year, 2 orthopedic teams down a year, and 2 ophthalmology teams down a year. So we had a pretty good idea of what they had, and we knew that they didn't have everything that we needed. So we collected a lot of stuff. So yeah, the interesting thing about it is if you're going down and you're working in a modern hospital in the United States, and you tell the nurses in the operating room, we're going down to a 3rd world country, and anything that you don't need that you're going to throw away that hasn't been opened yet, save us. And they'll put a big box there, and they'll save you so much stuff you can hardly believe it, because there'll be sutures that were never opened that they'll throw away. There'll be packs that were never opened that they'll throw away. They'll put in there, and we can take with us. But from the plastic surgery point of view, there were several instruments that we knew they didn't have. Now, plastic surgery instruments are not big instruments, so you can stick them in your suitcase. They're very specific. Yeah, one of them is a retractor for the mouth, and we knew they didn't have one. And we wanted to leave one, so we talked to the surgical supply people, and they wound up donating one that we took down. We left in there. We took suture down, we took some medication down. Of course, we didn't take any narcotics because of the problem of taking narcotics down, but we did take antibiotics, and we took local anesthetic agents down with us. In China, it was a little bit different. Esperança had never been to China. In fact, when we went to China, China was still deeply under communist control, and there had been virtually no outside people coming. This was right after the Cultural Revolution, and they decided that they were going to open it up to the Western world. And so the University of Peking invited Esperanza to come as one of the very first groups to come from the outside. So we had no idea what they had. And what they didn't have was a little frightening at the time. I'm sure it's very, very different there today. But maybe as we go along, we'll tell you about some of the stories that we dealt with what we didn't have when we were down there.
But we
what they wanted
managed.
us to do.
We managed.
Oh yeah, we still
We
did a lot of
managed.
surgery.
Yeah.
We'll tell you that procedure story a little later on.
Later on.
Okay, it's interesting. It seems like the relationships that one has within one's own working environment always pay off in terms of collecting some of these supplies. If you know someone that knows someone in the supply management area, then you can get what you need, right? And that's kind of how Esperanza's in-kind donation program works as well. So we're very grateful for those people that make those donations happen. Moving on to the next question. I wanted to ask, this may be a little personal, but hopefully you don't mind getting a little personal. Did you have any fear of going to a new country? I mean, Brazil, China, back in the day, traveling there, were you scared of anything in particular traveling there?
Well, you want me to start first? I guess the answer is yes. Not so much personal fear of traveling, because we had done a lot of traveling. So we knew how to prepare for traveling. If we were in an area where there were mosquitoes, we needed to take prophylaxis for certain medications.
And we
did that, and we took.
did.
But I think the fear is going in and doing surgery in a facility that has much less capability and backup support that you're used to in a modern American hospital. I think the biggest fear is losing a patient. And there have been a couple of plastic surgery patients lost after lip and palate where they've had uncontrollable bleeding and they've lost a child.
They
That's-
meaning the local.
Yeah, that wasn't any of the Esperanza trips,
No,
but
no.
that have been some of the other trips. So I think that's the biggest fear, is having a complication that you can't deal with properly, or losing a patient and not having the backup and the support backup and support to help if a patient gets into severe trouble.
However, we didn't have any of those experiences.
No, we didn't, but we thought about it.
Well, yes.
Yeah, I'm sure. Yeah.
Mhm.
Dr. Feuerstein, same question to you.
Pretty similar. I think that when I told people initially that we were going to Nicaragua, I think there is some public perception that Nicaragua was a dangerous place, mainly because of old news that was outdated. But no, I think it's fair to say, and Anna, you could confirm this, that both myself and most of the members of my team are ready to go when you ask us, and enthusiastically so. So really no personal concerns per se. I did have my young daughter with me on 2 of the missions, and that did give me some concern. In terms of what you do worry about, I agree with Dr. Schnur, the concern for being a little bit out of your comfort zone in doing what you do, not having necessarily the backup that you would be comfortable having. And I think a lot of it comes down to patient selection. There is some pressure when you get there to do whatever is put in front of you, and you want to help. But I think the important thing to keep in mind is not to get into a case that you could really get into trouble with, or that is going to force the local hospital to take care of a patient for a prolonged period of time. The missions aren't set up that way. We're set up to do a high volume of mostly ambulatory, quick surgeries if we can.
Maybe we should tell about it.
Yeah, can we follow up on a story, a personal story?
Personal story.
Sure.
Backing up what you said, when we went to,
Maybe
Oh.
we could put it.
yeah, I will. When we went to Brazil, the very first day, there were local doctors in Brazil who had collected the patients and brought them. So the first day we spent the whole day seeing the patients. And if I can screen share here for a minute, let's see. Okay,
This is the one.
okay, can you see that?
Yes.
Okay, so when we're seeing the patients, this nun came in with this little girl with a huge hemangioma. You can see here on the side of her face, this very, very large hemangioma. And I said to the nun, I said, you know, I don't think it's appropriate in this setting to take on a big hemangioma like that for the fear of bleeding. And the nun said to me, well, that's what the last two doctors said that were here, but you're going to do this. She needs to have it done and you're going to operate on her. So I had a really good out.
Well,
And
Paul,
so I said,
go
yeah,
ahead.
my out, can you see me okay? Can you see me in the window?
Yeah.
My out was, well, okay, I'll do it if I can have 2 units of blood standing by. And I knew that in
That wasn't
Brazil
gonna-
that wasn't
That
going to
wasn't
happen.
going to happen.
And the local doctor said, okay, by Thursday, we'll have 2 units of blood for you. And I said, where will you get 2 units of blood? And he said, well, the Jungle Blood Bank. So I guess my hand had been pressed. And I trained in a Catholic hospital, so I knew that you couldn't argue with nuns. And if you did, you never won the argument. So we agreed to do it, but we didn't have any idea what kind of equipment was available. So we went looking for equipment. And Barbara, you want to tell the story about this?
There was
These are bowel clamps.
yeah, they're bowel clamps, and they didn't look like that when we found them.
They were rusty.
And hadn't been used for a while, and of course they needed to be sterilized and everything. And so we took them out of the drawer and spent how many hours?
Well, we sanded them down and polished them and autoclaved them and used them to clamp the hemangioma off,
Mhm.
to clamp the blood off from the hemangioma. And we resected it and it went perfectly. We didn't have any trouble at
We
all.
didn't use
And I
any
think
blood.
We didn't use the 2 units of blood. And I think, let me see, I'll just show you real quick here. And there she is after surgery. She did very well and the nun was very happy. So it worked out okay, or we probably wouldn't have told you the story.
Yeah. Oh, it's an awesome story. And now that was actually my next question, and I'll share with you, Dr. Feuerstein. What's one of your most memorable experiences on an Esperanza mission?
We have many, but something that stood out to me occurred in Peru near the final day of our mission, and sort of gets back to doing something, a larger case. A woman came to our clinic with an enormous hernia in the front of her abdomen. You could see it through her shirt. She looked like she could have been pregnant, and she didn't complain of pain. She complained that she could no longer be of any help to her family, a farming family. And they had traveled the great distance to get to the hospital in Abancay. And our schedule was full, as it always is. And it was the second to last day. The team was tired. But this is one of those cases that we all felt that we were there for. And there was never any question we were going to do the case. And we fixed this big hernia with a piece of prosthetic mesh that we had brought with us, not expecting to use, and hoping to donate. And when we came out of the room, I realized that she had traveled there with somewhere between 12 and 15 family members who were all waiting for us outside the operating room. And it was one of the more memorable moments from that trip. And every single one of them wanted to greet us and thank us and hand us their grandchildren and
something, yes.
Do you remember what they tried to offer you as a thank you?
I don't.
They said, and to me, this stuck with me because it's just a sign of like they'll just give whatever they can as a way of payment, and they wanted to offer you a cold Coke.
Yes.
Yeah, they were like, "Will you please take a Coke?" And I was just, at that point I started crying because I couldn't hold it back anymore.
There were a few people crying that time, if I remember. And yes, and actually a cold Coke was about all the thanks we needed.
Such great stories. How about during these times we're in the OR for such long hours, you're in the OR for such long hours, and you get to build relationships and bond with some of the local staff as well. So is there anyone that you remember particularly, and if so, why? Dr. Feuerstein?
Yeah, the operating room is a unique place. I'm sure Dr. Schnur could confirm that it has its own set of rules, and there is a lot of the practices are sort of dyed in the wool at any institution, and there is a difference when you go outside the United States. It's a little bit more old-fashioned, and when you come into someone's OR, you are in their sacred place, and the best approach is to be respectful and mindful of the way that they operate, knowing that it might not be the way that you operate. So there's always a little bit of tension, I would say, and feeling things out and who's in charge and whose OR this is. And by the end of the week, that's all gone. And that all dissolves into real camaraderie. And because of the long hours and the hard work, by the end of the week, it's like a big family.
Mm-hmm.
And if you look back at your pictures, there's dozens of pictures with the entire OR staff, the people who clean the instruments, the orderlies, the perioperative nurses. It becomes an instant family.
Dr. Schnur, is there anyone that you remember in particular? Barbara?
Barbara, you want to tell a story about the syndactyly, the hand surgery we did?
Actually, every patient is a special patient, was a special patient to us. One in particular was a young boy who had syndactylism. And so
Syndactyly is when the fingers are grown together.
So Paul did the surgery.
Separating the fingers.
Separating the fingers. And then the next morning, we're making rounds early in the morning. And he was there to see us and was in the corner. I still see, too bad we don't have his picture.
No, we don't have a picture.
He was in the corner of one room. And as we walked in, we got this big thumbs up.
He had a big dressing over his hand, and the only thing sticking out was the thumb.
And so
we took a picture of him.
we have that picture, but we don't have it on our computer here.
Mm-hmm.
And so when we went home, we of course showed these photos to our children. And our son David at the time was a teenager.
I think he was 10 or 12 years old. Yeah. Well, he was probably 12 or 13 years old, and he saw that picture, and ultimately he became a plastic surgeon.
It made such an impression on him.
He tells us today that the reason why he's a plastic surgeon was seeing that picture.
Was seeing that little boy and his reaction to his dad and to me.
He's a hand surgeon today.
He's a hand surgeon.
And he and I have been on trips.
Yes,
on
together.
trips together.
Oh my God, what a special story.
Not Esperanza,
Esperanza,
but other missions we've been on.
Wow, that's wonderful. What a great impact, right? Like, how do you even measure that? That changed a person's life, two people's life, a whole family's life. That's wonderful, and you really can't put a price on that. Switching gears a little bit, I want to ask a little bit about the culture and the food. Was there anything about the culture of the food that stood out to you guys? Any particular memory? Dr. Schnur and Barbara?
Well, first we'll start with, I'll tell you something, a little bit about something in Brazil, a little bit about something in China. And in Brazil, we ate in the compound all the time. And we lived in a compound. It was a Esperança owned compound. So everybody that worked there were Esperança employees, the cooks and the people who took care of the rooms. And they fed us well. And it was Brazilian type cuisine. There was an American who was the CEO down there who had graduated from Thunderbird School
Here in Phoenix.
in Phoenix. And so he interpreted a lot. But one day they served us meals and they said, this is a fish and it's going to taste a little bit different. And we said, well, how is it going to taste a little bit different? And they said, well, you're going to feel some numbness in your mouth. And sure enough, when you ate the fish, the entire inside of your mouth went numb, like you had been drinking Novocaine. And actually, this fish has a cane in it as part of its body fluids. And so when you cook it and eat it, it actually numbs up the inside of your mouth like Novocaine, like when your teeth worked on. So that was a little bit awkward. In China, of course, it's a whole different culture in China. And this was 19th century China, and we ate all the time. I mean, we ate Chinese food for 3 weeks. So I think when we got back, we didn't eat Chinese food for another year. But it was good and it was interesting. The the Peking duck would have the head and the feet in there along with the rest of the duck, and we ate at a very special. They took us to a special restaurant for Peking duck, and the name of the restaurant was the Sick Duck. And so we wondered if we're eating in the sick duck, eating Peking duck in the sick. And then they explained to us that the reason I was named the Sick Duck was because it was across the street from the hospital.
Oh my God, that's hilarious. I love it. That's awesome. Dr. Feuerstein, I know you're a foodie, so I'm waiting to hear what you have to say.
Sophie is charged, and pretty much everybody on the team is as well. So I think you may remember from Nicaragua, we had a list of well-researched Nicaraguan specialties that my colleague, Dr. Glenn, carried around with him and crossed off as we accomplished each one. And if we had trouble getting it, our local team was happy to have a family member make it and bring it to us.
Oh,
So
wow.
we really wanted to have a tour of the country from a culinary standpoint, and we ate everything from street food. Not sure I'd recommend that. We all did fine, but we tried everything we could in Nicaragua. And in Peru, the location of the hospital we worked in, that was not a very touristy city. And so food was pretty limited on that part of the mission. But Peru in general has probably some of the best cuisine in all of South America, with very interesting flavor combinations, a heavy Asian influence. So the food in Cusco in Peru was phenomenal. And yeah, no matter where we are, we find local things to eat, because it really tells you a lot about the individual country you're working in and about the people you're working with.
Just as an aside, when we were in Brazil, I told you that the CEO was a fellow from Phoenix who had trained at the Thunderbird School. And so every evening, or not every evening, but several evenings when we finished late at night, he'd say, let's go out to dinner. I'm going to take you to dinner. So he'd take us to a restaurant somewhere in the town of Santarém where we were. Now, my father, who was a physician, whenever he would go into a restaurant, first thing he'd want to do is see the kitchen. So he'd ask the waiter if he could see the kitchen, and he'd go back, and Barbara learned from him. But when we got in these restaurants in Santarém, Barbara would say, I'd like to go see the kitchen. And our host would say, no, you don't want to go see the kitchen. Just sit down and enjoy the food. But we didn't get sick. We did take prophylactic gastrointestinal antibiotics, so we didn't get sick.
But one other thing, remember Brazil is what, Portuguese.
Portuguese, yeah. So
And
that
so
was
we
a
had,
challenge.
that was another challenge that we had with the language someone. But never mind, you just do what you need to do, and everything worked out just fine.
Yeah. I think the most interesting thing we ate in Peru is cuy, which is guinea pig. I
Mhm.
think a lot of people on the trip were surprised to see that on a lot of menus.
When we were in Peru, we saw a picture of the Lord's Supper, the Last Supper. And on the table was guinea pig,
Guinea pig.
been painted by a
It was
Peruvian
a
artist.
painting.
Oh yeah, there you go. Yeah, it's customary to them. It's normal, and it's only weird to us. So, I will say, when it comes to figuring out where teams are going to eat and stuff like that, I take it very seriously because the last thing I need is team members being sick and then not being able to do surgery the next day. So when teams like to go off on the street and eat the street food off the street carts, I just have to look away and pray to God that no one gets sick because they're under my watch, and I'm just like, oh my God.
Yeah.
That's a little bit stressful at the time, but usually it turns out okay.
And it did for us. Remember, we had to get up early in the morning. We're there late at night, and
Yeah.
so it was an interesting. We just had to put it all together, which we did. We had no unusual areas, no unusual things to
No.
report.
And in China, we ate in restaurants. We ate in restaurants all the time, or in the hospital, and it was the standard Chinese food.
Okay.
Is there any way that you celebrate the end of your trip, the end of your mission? Dr. Schnur, Barbara, was there anything that you normally did? Can you
Yes.
tell us a little bit about that?
Well, when we went to China, Esperanza actually, this was the only time Esperanza had ever been to China. They never went back again because they didn't feel it was a real mission of Esperanza. And it was a real trial experience. So we had some time before we left being taught Chinese culture. And they made us all our business cards with our names on one side in English and our names on the other side in Chinese.
Oh, cool.
They showed us how to hand them the cards. And so the one thing they said is don't hug. Chinese don't hug.
Don't
And if
touch.
you want to touch or hug somebody you meet in China, they're going to be offended by that. So don't do that. So we had to remind ourselves not to do that because we had a number of nurses with us, and the nurses befriended the Chinese girls. They would go out early in the morning when the Chinese would go out in the park. Our hotel was across the street from the park, and all these people would be in the park exercising, and
6
our
a.m.
nurses would go out and exercise with them. It was hard for them not to hug them. But I'm going to show you.
See if we could find the photo.
I'm going to show you if I can screen share here for a minute. Okay, let's see where. Okay, share. Okay, no, that's not the right one.
It's another talk we're
Yeah,
giving.
hold on just one second. Well, okay, I think I closed that one. So let's go on.
There's Esperanza presentation.
Yeah, okay.
It's actually,
Let me do this real quick here. Okay, we'll go down here to the end of China.
yes, because we have it here, honey, at the very end. It's a very interesting slide that we would like to share if we could find it in a hurry.
Okay, here we go.
We found it. We found it.
Great.
Okay, so the story here is that we worked in 3 hospitals, and at the end of each hospital, they would put on a big banquet for us. That's where we had the sick duck or the Peking duck. So this was our last evening, and this was our celebration, the very, very last evening. And our daughter, as you can see, the girl in the.
We can't see it, Dr. Schnur.
Oh, you can't see it?
No.
Let me try here. Can you see it now?
No.
No. Okay. Well, then let's just tell the story. Hold
Okay.
on. Now, okay, let's just. So on the last evening, they put on a big celebration for us at the hospital. They had a banquet, and everybody was there. And our daughter went with us on the trip. She had just graduated from the University of Pennsylvania Nursing School, and she was working as an intensive care nurse in CHOP, the Children's Hospital of Pennsylvania. And she went with us, and she worked in the recovery room. And so she was the youngest one, and she was the daughter. So when we had this big banquet, at the end of the banquet, one by one, they gave us each a gift, and each gift was different. And some would be a wallet, some would be a figure, or some would be, various things. So they got down and they didn't give anything to Polly. And so we thought, well, maybe they thought she was the daughter and that wasn't appropriate, and she was the youngest. And then they went in the back and they brought out this big panda bear. And they gave her this big, huge panda bear, and they all gave her a big hug.
And they gave her, not they didn't touch us,
Yeah.
but they gave her a
But
big
all the
hug,
Chinese ladies gave her a big
a
hug.
big hug.
Oh,
And
how
so
sweet.
fabulous, fabulous moments that we had actually.
That's a wonderful way to close out a mission and get ready to come back home with their hearts full and full of energy, right?
Absolutely.
Dr. Feuerstein?
Some of it really depends on where we are. The situation in Nicaragua is such that I think we are very appreciated by the local nonprofits we work with and by the physicians we work with, but we don't really receive recognition from the hospital we work in. Matter of fact, I've never seen them. So there, the celebration is basically limited to the personnel who participate. And there's always a big group photo and in the operating room at the end of the last case. That's a tradition. And then usually a big meal at the end. And that's always been the case in Nicaragua, including during the mission. If it's somebody's birthday, we will go out as a group in the back of a pickup truck usually. In Peru, it was very formalized, and on the last day of our mission, there was a ceremony in the offices of the president of the hospital, and every person that participated in the mission was called up and recognized and given a certificate, and as the Schnurs experienced, a small gift. We all got gifts from that hospital.
Excuse us just a second.
No worries. There are actually some questions from the audience. So I'm gonna kind of read through them and present them to you. One of them is, do your hospitals or practices, your places of work, do they support your time off for the mission, or was this personal vacation time? Whoever wants to answer.
Go ahead.
This is always volunteer time. So the participants, doctors who participate in the mission and volunteers are responsible for their time and for their travel, their food and lodging. So while on occasion an employer might support someone's travel or something like that, it's always volunteer time.
Yeah, that's true for us. I think when we went on the first trip, I was in private practice, so it was just a matter of taking time off. On the second trip, I was working for Mayo, so Mayo will allow you to travel on their business, but since this was not their business, it had to be vacation time.
We took vacation.
There's another question asking if there's any adjustments made for surgery at altitude. I'm not sure about Brazil and China, but where we work in Nicaragua and Peru, we're not really working at high altitudes, unless, do you count Peru as high altitude, Dr. Feuerstein?
Oh, we had we had an issue with several health issues in Peru. A significant portion of the team became very ill. And one person in particular had, one of the surgeons had tremendous difficulty with the altitude. Abancay is in a little bit of a valley, but Cusco is at 11,000 feet. And that person really didn't feel well for the duration of the trip. So a little bit. Several of us did take prophylaxis for altitude sickness, and it seemed to help.
In terms of adjusting the surgeries themselves, though, like the procedure, do you have to make any changes for that?
Not that I can think of.
Well, the one experience we had was in Brazil. In Brazil, the one operating room was air conditioned, and that was the only place that was air conditioned. So the recovery room and the wards were not air conditioned. It was very, very hot. And we found out by late in the night that we were way behind on IVs for support of the patients, because we were ordering the normal IV solution that we would give for a patient in a hospital air-conditioned unit. And we certainly learned after a couple of 3 nights being called by the nurses and saying these patients don't look so well, that we needed to almost double the amount of IV fluids we were giving them compared to what we'd give them in an air-conditioned hospital.
Yes, we ran into similar issues with air conditioning and not having it.
I see on here, we also have Dr. Mordecai Gemmer present with us. He is actually also a past Esperança volunteer. Welcome, Dr. Gemmer. He traveled to Bolivia with us. I'm going to welcome him to add any questions to the chat. Unfortunately, I can't mute you to have you share, but if there's anything you want to share, please pop it into the chat and I'll check it in a bit. Meanwhile, I'm going to move on to the next question. It says, I'm sure there are crowds that show up after hearing of these missions. How do you prioritize cases with the limited time you have? Dr. Feuerstein?
It's very challenging, and it can be a little overwhelming on that first clinic day when you get there and you say to yourself, this is all here for us. And in Peru in particular, they kept the clinic open all week. So we were being asked to come out of the operating room with an already full week schedule and continue to evaluate people. It's very hard because you don't want to say no. But for instance, there was an issue where some local, call them VIPs, the sister of a local doctor or a family member of an administrator would come for a purely elective surgery. And fortunately, usually that was handled internally for us because as visitors, we didn't want to be turning people down, but that's not really what we were there for. So there are some political factors to consider, but mainly our job is to do as many surgeries as we can that are within our comfort zone as quickly and safely as that facility will allow us to do it.
Yeah, I certainly would agree. I think generally speaking, there's many more cases than you can do in one sitting if you come for 2 weeks. And we may operate from 7 o'clock in the morning to 9 o'clock at night. And in some cases have 1 operating room, some cases have 2 and 3 operating rooms. But it's a matter of prioritizing the patients. There's some patients that have problems that you can't really do a lot for. And you sort of have to diplomatically say, I don't think we ought to operate on these patients. There are other patients like some of the cleft lip patients that have such a wide cleft lip, you need to have preparatory orthopedics to pull it together. And so you tell them, well, the next time somebody comes down, we need to get, we need to know about it beforehand so some of this can be done. And you always can offer them another time because on almost always Esperanza's coming repeatedly, and they can be taken care of on the next time, but it's really tough.
Sometimes
So-
there are people who have been turned down multiple times by other missions, by tertiary hospitals in their own country, and they come to the clinic a little bit out of desperation. And many of these things are not, again, the types of surgeries that you can take on in the settings that we're operating.
I know we're a little bit out of time, but I did want to close out with one last question. What would you tell other future surgical volunteers about Esperanza's surgical mission program? Dr. Feuerstein?
I would say that it's the most selfishly unselfish thing that you can do, and that it is gratifying in a way that very few things that we do in our professional lives are. And I don't say that just for myself, but for the people that have joined us on our team and the people that keep coming back. And that's why we have such a dedicated team, is because of the satisfaction that they get from doing this. It's different than anything else we experience.
Dr. Schnur, Barbara?
I think we just tell them it's a life-changing experience, and it really is a life-changing experience. For those of us who practice in the United States, there's all kinds of secondary interest in practicing medicine, like insurance companies and hospital privileges and hospital rules and regulations. But this is medicine at its basic element, where you're just taking care of the patient. And so that's why it's a life-changing experience.
I couldn't agree more. It sort of boils down what we do to that basic thing that we all went into it to begin with.
Sure.
Well, thank you all so much for your time, for sharing your stories, for sharing your memories with us. This has been a wonderful time. I've learned a lot, and I definitely want to kind of keep picking your brain, but we are out of time for today. I want to thank everyone that has joined us today. Hopefully you've learned a little bit more about our surgical program, about our volunteers and the great work that they do in all the countries that we work in. And I want to invite you all to, if you haven't yet, please register for the 50th celebration that's coming up on November 10th. We're very excited. We have really cool programs set up for you. If you register by November 2nd, that's Monday, you will get a nice little package in the mail to accompany you with the celebration. So please share the news and invite everyone you know to come and help us celebrate this huge milestone that we obviously would not have been able to accomplish without all our volunteers, our donors, and supporters. So thank you, everyone, for your time today.
Thank you.
Thank you.
Thank you.
Thank you, Anna.
Thank you.
And thank everybody for coming.